Good morning, everyone. I'm Russell Myers, CEO of Midland Health, and this is our coronavirus update for Friday, April 17th, 2020. Beginning with numbers, in Texas, there are now over 16,000 confirmed cases of COVID-19. 384 deaths have occurred in Texas so far. Here in Midland County, we have 41 confirmed cases and 2 deaths. The hospital is getting close to 1,000 tests that have been sampled so far, 49 of those positive, which includes a handful of repeats, 840 negatives. We're waiting on results for 80 cases. So a couple of those are as old as this past Monday, but for the most part, testing turnaround does continue to be 48 hours, give or take. In the hospital, our census is now 123 overall. We saw 80 patients in the emergency department yesterday. In critical care, we have 15 patients. Patients or persons under investigation, there are a total of 15, 7 of those in critical care, 8 in other medical surgical environments. 6 of those 15 are confirmed positive. In the last few days and continuing into the next few, we have begun talking about what it might look like to reopen some of our economy, to reactivate some of the elective work we do in the hospital. We continue to be cautiously optimistic and to work toward procedures that will allow us to do elective procedures in the hospital. Our surgeons, our doctors in gastroenterology who do endoscopy, our heart surgeons and cardiologists have all had discussions over the last several days. And we do have some plans for how to potentially reopen in a very cautious manner, depending on what we hear from the governor. As you all know, Governor Abbott has a press conference scheduled for today in which we expect he will announce what he intends to do about the moratorium on elective procedures that he put in place this coming Tuesday, April 21st. So we're trying to be well prepared for that. We also received yesterday, as the nation did, the president's new guidelines for the reopening of economies across the country. There are a variety of elements of that program that have to be digested. I'm sure will be considered by the governor as he determines over the next few days how the state of Texas economy is going to be revitalized. And so we're trying to pay attention to everything that we're hearing from our government officials, preparing for how we in Midland may react to those, to whatever propositions are offered to us from Austin, and trying to remain cautious. As we do that, one of the key components is to maintain as much of the social distancing and other precautions as we possibly can as people begin to become more active in the days ahead. So there's a lot more to come on that. I think in the early part of the week, we'll have a good bit more to say once we've heard from the governor today. There is concern, as you all know, in this community about the Midland Medical Lodge population. There have been several positives, both among residents and staff there. Several of their patients are in the hospital here at Midland Memorial. We have been in contact with those folks over the last several days, and yesterday made a decision to send a team from the hospital to Midland Medical Lodge, where they are at this moment, testing the remainder of the resident population there to see what they are dealing with, and to do our best to try to predict what hospital volume may be coming from that outbreak at Midland Medical Lodge. Our team should be over there today. We'll have test results back within probably early next week, and then we'll have a better sense of the extent of that outbreak and how to predict what it's likely to, how it's likely to impact the hospital in the days ahead. In addition, we know that nursing homes in general are a risky environment. They're filled with vulnerable people, as we talked about yesterday. And so our case management team yesterday did some polling of the nursing homes in our community and in the surrounding areas to assess how they stand with regard to patients under investigation, if they have any, what their PPE availability is, and how they are prepared to manage any infections that they're aware of within their environments. For the most part, I think we got very good feedback. If nothing else, we opened the lines of communication with these facilities and expect that our team will be in regular contact with them. We want to be able to help the nursing homes where we can if they have needs for managing their own populations. But most importantly, from the perspective of the hospital, we want to know what's happening in the community and do the best we can to anticipate cases that might be ahead of us in the next few days. And so we're going to continue to be very, very assertive in keeping up with the populations in the nursing homes in the region over the next days and weeks. Finally, I'd like to offer some thanks. Today, I want to talk about our physician practices. As you all know, the hospital is actively involved in the management of premier physicians and Permian cardiology and West Texas orthopedics. In all of those cases, the providers, the physicians, the PAs, the nurse practitioners, the nurses, and the rest of the teams in those practices have been very creative. They've moved rapidly to make telemedicine visits available to their patient populations and have ramped up that capacity rapidly. We're seeing a lot of patients via telemedicine in all those practices now. We're also beginning to talk to them about being a little bit more liberal with allowing patients to come in for visits. As we get more and more weeks into this thing, we all recognize that patients need to see their physicians. They need to see their providers. And so we're working on plans for how to do that safely. And those practices have been very creative, very flexible in dealing with this new reality, and in the days ahead will be really vital to our community's recovery. And it's not just the practices that the hospital is involved with and manages. Really every community practice here in Midland has responsible providers who care about their patients and have done everything that they can to make themselves available and to help the community respond to this virus. So a big shout out and thanks to all of our physicians, all the nurse practitioners and physician assistants working in our community, trying to keep us safe, to keep themselves available to their patients in whatever way they possibly can to assure that we all can stay as healthy as possible through this pandemic. That is the extent of my prepared remarks for today, and I'm happy to take questions.
We have a question on Facebook. Can you comment about the testing accuracy in light of media reports regarding it?
I think Dr. Wilson may want to comment on that. We have had some conversation about that in the past. Larry?
Good morning. So the question is about testing accuracy, and I'm going to make the assumption that we're speaking specifically about testing for COVID and a positive COVID test or a negative COVID test. And we've addressed this a few times here, and it can vary a little bit depending on who you ask, but by and large, I think the recognition is that the PCR test, which is polymerase chain reaction test, is very accurate. If there is RNA from the virus, which is what the virus is made of, in the area that you're testing, it will come up positive. The problem the virus is located in one's body at any given time and how well the swab is taken from that area that you're trying to achieve the viral testing from. So if you take a swab from inside the nostril and the patient has a deep respiratory tract infection, you may not pick up any virus. There's pretty good evidence that if you take a nasal swab, there's a pretty low sensitivity or accuracy of the test. If you go deeper with the nasopharyngeal swab, it's much more likely to pick up virus. And if it's an unfortunate circumstance where there's a tube in the lungs and you're ventilating a patient and they can go down and get a bronchial lavage, there's a very high accuracy. So it can vary depending on where the virus is shedding at any given time, how well the sample is taken. But the test itself, if you have even a small amount of the virus on it, is generally very accurate.
Thank you, Dr. Wilson. Are there further questions?
We do have several coming in. We have a question from Caitlin at the MRT. Do you know how many residents are being isolated at Midland Medical Lodge, and how many PUIs are there across the nursing homes you've been in contact with?
There are 14, we understand. Of course, it's a fluid situation, but there are 14 in isolation at Midland Medical Lodge now. As I recall, The survey that our case management team did across nursing homes in the area found only the one PUI, which we were already aware of at Manor Park. So that's obviously subject to change, but as of now, that's what we understand.
We have another question on Facebook, probably for Dr. Wilson. Is remdesivir being used to help patients in our area?
We had that question yesterday. Larry?
Yes, thank you. Yeah, we addressed that question yesterday. The remdesivir is a viral inhibitor that has been in scarce supply. We have requested it on one occasion or two occasions, I believe now, and not been able to get access to it. It's a supply-demand issue and supply chain issue. There are congener drugs or drugs that are similar to it that we have been able to utilize on a few occasions.
We have another question on Facebook. How many days does it take now to find out if you have COVID-19 when you're tested?
That varies depending on a lot of factors. We know that the labs that we've used are seeing high volumes of testing still. Their turnaround time varies depending on the volume that's in the lab. So we have had tests come back as rapidly as about 24 hours. But this week, we still have tests outstanding from Monday. So it has varied lately anywhere from 1 to about 5 days, more commonly about 2 days. But you never know for sure how fast a test is going to come back.